Hi, everyone. This is Jean Sachs. I'm the CEO of Living Beyond Breast Cancer. And first and foremost, I hope you're all doing well and staying safe. Today, we are talking with Dr. Lyndsey Harper. She is a board certified OB-GYN in Texas, and she also is a fellow of the International Society of the Study of Women's Sexual Health. In addition to her medical career, she decided to create an app, and she is the CEO of Rosy. And this is an app that is completely dedicated to connecting women to sexual health information. So we're going to talk about the app and learn more about Dr. Harper's journey as to why she added this to her probably already busy medical career. So welcome, Dr. Harper.
Thank you. I'm so happy to be here. Thanks for having me, Jean.
Of course. So let's just start and tell the viewers what led you to really focus on sexual health.
You know, it was my patients. I felt pretty confident helping them with, things that we're trained to do in residency and medical school, like pregnancy, surgical needs, menopause, contraception, sexually transmitted infections. But there was a huge gap in my ability to help them with sexual problems. And my patients would come in, as we develop these long lasting relationships and tell me things like, Dr. Harper, I love my husband or partner, but I don't care if we ever have sex again. Or they would have problems with, painful intercourse, trouble with orgasm. And I, outside of this framework of endometriosis, fibroids, prolapse, didn't really know about sexual response, sexual dysfunction, and that's because I hadn't been trained. And in fact, it's not just my experience, but the experience of most OB-GYNs that they do not get trained in women's sexual health. And I think that, we expect as a society and probably as women that OB-GYNs are the ones to go to for these problems, much like maybe a urologist is for a man. But in fact, that's not the case. And so women are left with these problems. 43% of women have some sexual problem or complaint, and very few of us are equipped to do so. So once I realized that and the discrepancy between the available sort of treatment for men and women, I got really mad, which is where all good ideas start. And, just really decided to go full force and see what I could do, in the field and for women that I was caring for.
Well, first, thank you so much for listening to your patients. I think that is so important, and also so happy that your patients actually felt comfortable enough to come to you and raise this issue. We certainly know it's a hard thing to talk about, and I know for the breast cancer community, breast cancer has such an impact on so many things, but absolutely on your intimacy and sexuality, and often very hard to know, who to talk to and how to bring it up.
Absolutely. Well, I thank my patients for bringing it up to me because I wasn't doing a good job either. Only 17% of OB-GYNs even ask their patients about sexual health, which is an atrocity. So the fact that I wasn't asking, but they were still telling me was such a gift to me and has really helped to kind of push this forward. So I'm definitely on the same page. It's all my patients for sure.
Yeah, that's great. And so you went on to do additional training, is that right?
I did. Yeah. So I asked around, I'm like, where does one even learn about these things? And there were a couple of women OB-GYNs in this bigger group on Facebook that I was in. Most people had no idea, but a couple of them said, oh, check out ISWISH. And it stands for the International Society for the Study of Women's Sexual Health. They have a fall training program. And once you've attended so much training and demonstrated competency and contribution to the field, then you can become a fellow. And so over the course of a few years, I became a fellow of ISWISH.
So is there a way for a patient to know if their gynecologist has that training, or a way to identify someone?
Sure. Yeah. So the ISWISH website, which is isswsh.org, has a list of members, and you can search by city. So that's one way to find it. And what I'm trying to do on my side is sort of get this information out in digestible bites, not only to patients, but also to providers. And so I also go around and do grand rounds on the topic at different medical systems, just to say, you know what, we don't have to shy away from this. There's this idea in medicine that women's sexual health is too complicated or it's Pandora's box, right? And us as busy practitioners feel very, crunched for time. And when that's doubled, that sort of negative feeling is doubled by the lack of training, then we're really just never going to talk about it. Right. So I feel like it's part of my job to say, break it down and say, if A, then B, and if C, then D, make it very approachable. It's just a baseline level of knowledge that's needed to encourage these providers to be the ones to initiate these conversations.
Okay, that's great. So when you think of sexual health, sort of what are you looking for? What do you think women should be trying to achieve?
Yeah, there's no goal, right? That's part of the answer, is that it's not a destination, but maybe more of a journey. And, I think that really for me, the key to healthy sexuality probably are two things. Number one, the ability to communicate about sex, right? And that is true within so many circles, maybe amongst our friends whom we trust, amongst our partners with whom we're romantic, and specifically for me with our healthcare teams, right? And so that's a very good sign. When you have the education and the language to be able to hold those conversations, that's a sign to me that you have some healthy sex habits going on. Another thing is the ability to negotiate a problem, right? So say, there's a discrepancy in desire in a couple, or say you're having pain, or say, you're experiencing changes due to menopause or surgery. Whenever you come into contact with an issue, how able are we to negotiate those issues? And that goes back to that communication piece, right? So first has to come communication, and then we practice over time talking to those people in our ecosystems, and that is where we're able to find the answers to whatever's going to come up, because it's not going to happen just once, but it's going to happen multiple times throughout our lives. And when we're able to navigate and negotiate those problems, that's really what it's all about.
Right. So I have been on your app, and there is a lot of information, and you can look at a lot of short videos, but just tell us maybe in a few sentences, like what are you trying to achieve with the app, and how does it, how do people get it?
Yeah. So for me, the most distressing part of these women who would share with me in my office is that they truly and deeply felt that they were the only ones. Like they thought they were a complete anomaly, and that they trusted me enough to tell me. But what I would try to tell back to them is, you're not the first person to ever tell me this. In fact, you're not the first person today to tell me this. Like, these are actually very common things, but we receive signals from our society. No one talks about this in the media. No one talks about this, right, in medicine. So we get these signals that either A, we're not allowed to talk about this, or B, it must not be a very big problem, right? If no one's talking about it, maybe it's just me. And along with that sort of lack of conversation comes isolation and shame, and that compounds the problem. So really what we're trying to do, in the first place, is really start those conversations and tell women these are really common problems. And just because nobody talks about it, that's our fault, not your fault, not the woman's fault who's experiencing these issues. So we have to, as women, say together, this is absolutely unacceptable and we deserve better resources now. So we're trying to start that conversation. And then another super important piece is really bringing together the evidence-based resources into one spot where women can say, okay, I have a sexual question or problem. I know I need to go to Rosy, and I can find whatever the next step is.
Yeah. And that's great, because you can do it kind of in private. You can do it, you're just looking at your phone. Nobody has to know what you're doing, which is great. So just to bring it back to our community, which is obviously women diagnosed with breast cancer, and often, there are a lot of changes, whether it's early menopause brought on by medication or surgery or change in your body. So maybe just say a little bit about, how can this group of women, really get back to some kind of satisfying intimacy and sexual relationships?
Absolutely. I think, it starts with learning what the common sort of outcomes of, having a breast cancer diagnosis and going through treatment the effects that it could have on your body and on your mind, right? And so, as you mentioned, there's lots of those, right? When we go through, when we're taking medications that can induce menopause, when we have our ovaries removed and menopause happens really quickly, there can be lots of changes, including a lack of desire, dryness in the vagina, sort of tightening and shortening of the vagina. And also body image issues. That's, we hear about that very frequently. Your relationship, obviously, with your breast change, there's a lot of anxiety and depression that seem very obvious, so all of these, play into who we are as sexual beings, and being just simply aware of those things can actually be very therapeutic. So saying this is what might happen. These things are really common. And then if you identify with any of those concerns, here are the next steps to try to get you back to feeling not more normal necessarily, but really maybe even thriving more, in this circumstance of life. Many, I think, women haven't had the opportunity to navigate a sexual problem before, haven't taken advantage of it. And I think in that way, it can be a real opportunity, to communicate openly with your partner, to be reflective about your own sexuality, and then to challenge your healthcare teams to rise to the occasion.
Yeah, that's really helpful. So I just want our viewers to know that if you download the app, which is free, you can get a lot of information. And then I think if you want to dig deeper, there is a small fee. So I encourage everyone to go to the App Store and just download it. So just one of my last questions is, if someone is struggling and they're ready to go ask their healthcare provider, sort of how do they bring it up?
Yeah, I know, it's such a good question. We get this a lot, like, how do I bring it up with healthcare providers and how do I bring it up with partners? And, I think, well, we always say you can blame it on us, right? You can say, hey, I saw this thing on, Living Beyond Breast Cancer, or I saw this crazy doctor who made this app, Rosy. And, they said that vaginal dryness after I've been on, XYZ medication can be really common. Can we talk more about that? Or so they can sort of displace the conversation and then kind of bring it back. Or, these issues are very common, and most providers can and will treat them. And if not, they will refer you to someone who can. So I would just say to open the conversation in a very honest way, to say, you know what, I have been having pain with sex for 6 months and it's not getting any better. These are the things I've tried, maybe moisturizers and lubricants. I need help because this is really affecting my life. What can we do about it? So I know I talk about this stuff all day, so I no longer have the internal sort of negative reaction when I try to talk about these things. But the more you do it, the less you feel that way. And be very straightforward and matter of fact about it without, breaking down all the intimate details if that's not something that you're ready or want to do.
Right. And I think the other thing is, if your healthcare provider isn't receptive or isn't giving you the information, then it often is time to go consult with a second opinion. So that is really good advice. Just, you have to start having the conversation. So before we end, is there any other quick advice you want to share?
I just really appreciate advocates like you, Jean, for starting these conversations, because you and I both know what a hot topic this is. And if you go and maybe look at it on different forums, there might not be a lot of conversation because people are embarrassed. But we know as advocates, because individuals reach out to us, that these are very common and important topics, and you deserve help. So if you've maybe had, a bad interaction with one healthcare provider, I completely echo your sentiment to keep digging. A lot of us have to become our own advocates in this space, as unfortunately I know a lot of breast cancer survivors and thrivers have already encountered. And this may be just another opportunity to keep pushing, because definitely there is help available.
Yeah, that is really helpful. And I know for the breast cancer community, I've talked to many women who, felt like they had a very healthy sex life, and then they were hit with breast cancer, and so many changes happened. And then this was just another loss on top of a number of losses, and having the energy to say, okay, I really do want to work on this, I know sometimes is challenging. So I know for those people, you do have to figure out, what can you take on and when, because there's just so many different assaults.
Absolutely.
That happen. Well, I really want to thank you for joining us. So thank you, Dr. Harper. I want to encourage people to check out the Rosy app, and there's more information on Dr. Harper on our website. She also has built out content specifically for the breast cancer community. And we'll have another episode where we'll talk more about that. But thank you everyone for listening. Remember, Living Beyond Breast Cancer has closed Facebook pages. So if you want immediate support and connect to other women, go to our website and we will connect you to those pages. And then in the meantime, just please stay well. And again, stay connected with Living Beyond Breast Cancer.